Hello, I'm David Kerr, Professor of Cancer Medicine from the University of Oxford, and today I'd like to discuss the difficult issue of doctor burnout, doctors in distress. I'm going to come back to that term, doctors in distress, because it's the name of a fantastic UK-based charity that does provide significant mental health support for doctors in an attempt to try and prevent burnout. We would argue, and the evidence suggests, that those of us who are involved in cancer care have a complex patient pathway to follow. Apart from the complexities of treatment delivery, if you look at the emotional strain of guiding patients through that journey, which often can lead to death, is a difficult one. These are patients that we may be looking after for many years, in which we develop strong emotional attachments to, and we have to guide them as best they can throughout and along that patient journey. There's some interesting work that was done by the European Cancer Organization in a large survey of cancer-associated healthcare professionals, in which, and I was amazed at the levels of distress being suffered by my colleagues in the different disciplines involved in cancer care. Looking at some of the figures, it was published in 2024, so recently. It was a sample of more than 700 individuals across 30 countries in Europe. What we found was that almost 20% of healthcare professionals involved in cancer care reported high levels of burnout. 30% frequently experienced anxiety due to work pressures. More than half of the participants said that their supervisors don't care about their well-being, or the seemingly endless administrative procedures that make the work even more complicated. And 80% reported that they often needed to work overtime. If you like, a snapshot in cancer, but very reflective of the broader sense of burnout across medicine as a whole just now. And the idea of the old days of pull yourself together, work harder, I'd say perhaps the methodology that I grew up with, being of a rather different generation. Of course, that can no longer apply in terms of how we support and bring our colleagues forward. And if we're working within a multidisciplinary team, that means that we care for the team, not the individual specialties within it, but we look after all of us who are working together to deliver the best type of cancer care that we do. What solutions might there be for this? This is a piece of reportage in Lancet Oncology, which I do urge you to have a look at. The data provide a clear picture of the problem, and those of you listening as individuals will be aware of it, and either through colleagues or perhaps through your own personal work life. The charity that I mentioned at the beginning, Doctors in Distress, was born of distress. It was born by Amandip Sidhu, who reflected in the tragic death of his brother, who was a consultant cardiologist and who in 2018 committed suicide because of burnout and the extraordinary pressures that he was under. The charity is now well established, functions since 2019, and it provides fantastic support. Some of the figures are great. They've supported over 4,000 healthcare workers through free weekly peer-to-peer support groups, facilitated by professionals from a range of backgrounds, including psychoanalysts, psychotherapists. And these groups, I guess, they provide a safe space in terms of colleagues being able to discuss frankly and openly within a sympathetic and shared group what their feelings are, to try to work through them with the support of the charity. And has made a real difference. And of course, apart from delivering this form of direct support, they do a lot of work on awareness raising. So I would be really interested in what you think about this, how we address the root causes of it. Is it a health systems design analysis? Is it providing more generally available and psychological support for colleagues who are getting into trouble? Is it recognizing colleagues at an early stage who may be heading for burnout and seeing what we can do to support them rather than work harder or whatever the sort of old-fashioned type of advice might be. So we would argue, I think, cogently that burnout is a silent killer. I think it demands urgent and sustained action. I think the narrative that individuals must be in some way stronger just doesn't cut ice anymore. And perhaps we do need to think about providing a more structured method of support, being able to recognize someone like myself, a senior medic who has trained many, many young doctors over my long career in medicine, but to recognize when there are signs of trouble impending, of being able to roll back and provide support, and rather than just demanding more deadlines, we must get things done by such and such a time. Where's the paper? What about a book chapter? Have you got this patient sorted out? You can imagine the demands that we continually make of our juniors, other members of the team. So for me, this really was a genuine moment of reflection and thinking how I can adapt my own approach to training, to supporting my not only junior colleagues, but senior colleagues too, who may be heading for this distressing, career-limiting burnout. I'd be really interested in your comments, and of course, anonymously, if it's something you've experienced yourself, or if there are solutions that you might offer. We'd be really, really grateful to hear them. As always, thanks for listening. For the time being, Netscapers, over and out. And as always, thanks again.